everybody, and welcome to another edition of the Atlantic Cell Podcast. I'm here with a new friend of mine, Matt. And Matt, how do you say your last name? I want to make sure I say it right.
Binder.
Binder, and he is in from Easterseals, New Jersey, and he knows a lot about disability, I feel, and brings a lot to the table because anytime he has something to say at a meeting, it's always intelligent and always thoughtful. So I thought he'd make a perfect podcast guest. Hi, Matt.
Hi, Donald. Thank you so much for having me.
Yeah, so I always want to know like people's origin story because I get that question a lot. Like, how did you get into this work? So, how did you get into this disability world?
Absolutely. By mistake and on purpose all at once. So I, kind of found my way, through a normal online job application to Easterseals, New Jersey, had been working in the political campaign space and was looking to really focus on more issues, long term rather than a lot of issues short term. But what really drew me to the role was during my time in political organizing, over and over, people with disabilities throughout the campaigns I worked on were some of my best volunteers, right? People with disabilities, their lives are just heavily regulated and government facing, and they really understand, why it's important to be part of that process. I also had a long-term girlfriend whose brother had autism with fairly high support needs. And, that was really an introduction to the world for me, as well as my own mental health journey. And I've been here 3 years and I've loved every moment of it. And, we talk a lot about inclusion in this space. I'd be remiss if I didn't say, how, lovely it's been, how much everyone has included me. So I'm really grateful for that.
Yeah, and I love what you said about disabilities in the campaign because I always say whatever your feelings are on a particular issue, public policy disproportionately affects people with disabilities more than anybody else. We're more likely to be homeless or unemployed or need health care and need education access. So like these issues, if you have a disability, no matter what that disability is, whether mental health or physical or chronic pain, like these decisions affect you. And so what do you do? What do you do at Easterseals? How long have you been there? What does Easterseals do? Give me Easterseals 101 and then Matt 101.
Absolutely. So Easterseals, New Jersey is one of the largest nonprofit disability service providers in the state. We serve over 4,000 people, mainly adults and adolescents. And, our mission is to let people live, learn, work, and play in their community, right? So down in Atlantic County, what that looks like is we do a lot of disability employment work, supported employment for adults with developmental disabilities, as well as students and adults who are deaf and hard of hearing. We're one of the fiscal intermediaries. We help run one of the self-direction programs, Agency of Choice for adults with developmental disabilities. We have a day program in Northfield. So we are all over the place. We also do robust mental health across the state and also some senior supported employment. So we have our fingers in a lot of pots, which is really cool because I get to touch a lot of issues and have a lot of impact. Easterseals, I think the number one question I get is, what is an Easter seal? What is that name? So all the way back in the 1930s, actually right around this time, we just had Easter right there. It was, so stamps, an old timey name for them were seals. And so that was a long time, still is, springtime fundraising campaign for us, sending out these commemorative stamps. And so since they went out around Easter, we got the name Easterseals. So that's kind of our origin story. We've been in New Jersey for like 78 years. We've been doing this a really long time. Obviously what disability rights and disability programming has looked like has changed dramatically, but the mission remains the same and the work continues. For me personally, so I am the senior advocacy specialist here, which means I get to do our government relations and community engagement. So the really important work belongs to my colleagues on the front line, who are caregivers, counselors, you name it. But I have the coolest job. I get to think about disability programming and rights and stuff all day and talk about it. And, it's just been the coolest thing. I've come to really believe that, disability rights are probably the most important human rights campaign none of us think about. Right. And, that means something for all of us. I've listened to some of your other podcasts and, you hopefully talk about how we are all temporarily able, right? This is the
Yes.
movement for all of us. We can all take something from it. And it's about, that society can't chew you up and spit you out when things get tough or different.
Right, and I totally agree, man. I always say that not only can you join at any time, but you will join at any time if you live long enough. And also, you know, a world that is more accessible and more supportive of people with disabilities is a better functioning world, period. I mean, I always bring up curve cuts and electric doors. Like, would anybody give that up to go back to life before? Like, we make our life so much more difficult when we don't design for everybody, and I think people assume that you have to be inaccessible, and there's no reason why you have to be. You can design things and resources so it is accessible, and the beautiful thing is that doesn't take away from anybody. It makes things work better. So advocacy, that's something I'm very passionate about. We have a grant here at the center from the Division of Disability Services where we're teaching people advocacy skills and information and all that stuff they need to be more involved in civic engagement. I'm not just talking politics, I'm just talking being involved in, a book club or volunteering or, there's a whole lot of civic engagement. So a lot of our population, a lot of the people we serve sometimes can be very intimidated by advocacy. So I want to give you a chance to explain why that's important and also why they should still be involved, even though it can be hard.
Absolutely. So, to your point, advocacy doesn't need to be scared, right? I think the best way I've ever heard it put is you already advocate and do it all the time, right? If as a kid you asked your parents to stay up late or anything like that, or, asked, someone in your family to make something for dinner, you have already advocated. It's something we do every day. All this process is education, showing up and talking about what's important to you, right? So, we, do a lot of work to break down barriers, whether they're transportation, meeting format, you name it. But, for people, who are listening, who are, there's a lot going on out there, there's a lot of fear, there's a lot of concern, right? All advocacy is talking about what matters to you and saying why it's important and making an ask for something that you think will better yourself or your community. We've actually been doing some of that in Atlantic County as well. One of my favorite things that I have been working on recently is we started a self-advocacy group at our rehabilitation program in Northfield. I really want to give a shout out to Rasan Davis, who is the manager there, and our interim director of IDD services, Paula Kastner, for pushing it forward. And of course, and most importantly, the participants there who, have been just tremendous, in this, to your point, it's so much more than just, asking for something from an elected official. It's talking about your rights in the workplace, navigating things that matter to you that you think will improve your life. And, that can take many, many forms. So we all advocate every day. It's a matter of, just briefly thinking to yourself, why is this important? How do I tell my story? What data, if at all, do I need? And just being yourself.
Yeah, and I always say you bring us when you live with a disability or have a loved one with disability, you already have expertise that a lot of other people can't bring to the table because of your lived experience or your loved one with a disability. So I know sometimes people get intimidated and they see these public meetings and they're like, well, I could go, but I don't feel like I belong in a school board meeting or a business roundtable meeting or a state independent living council meeting. But you have plenty to offer, and you don't have to go in there and save the world. Just go in there. I always say, just go in there and listen. It's fine. Like, don't, these meetings are public. You have every right to be in a lot of them and, be respectful and be kind, which makes you go, gets you a lot farther in meetings like this than being rude. So just listen and say hi to a few people, and that's it. Like, you don't have to go in there and solve all disability issues by the end of the meeting. Like, just realize that you belong in the room. That's always my pitch to people. I go grow in confidence because I'm sure, Matt, you were intimidated at one point. I know I was, intimidated throughout other points. So that's why it's important. So there's a lot going on with disability issues, these days. I know one of the important issues that I always see raised is Medicaid, and I just want to talk about why Medicaid is so important to people with disabilities, because we don't endorse anybody here or talk politics in that way, but it's important to understand why these programs are like Medicaid are important and why you need to pay attention if there are changes being made.
Absolutely. So, Medicaid, for those who don't know, is the government healthcare program for people who are low income or disabled. There are 72 million people across the country, roughly, on Medicaid. In New Jersey, it's 1.85 million. So, it's almost 1 in 5 people here. That's their health insurance. And Medicaid is particularly important to the disability community because it's so much more than healthcare. It's also what are known as home and community-based services. That's a lot of the work that we do here at Easterseals, same at the Sills, right? So that can include things like transportation, housing, employment, you name it. And so we are really passionate about this program because it has provided opportunity for so many people. It is a hand up, not a handout. And I think it's also, Donald, you know this a lot better than I, but just due to a lot of restrictions to be on Medicaid, right? There are a lot of providers who are unable to offer things private pay or private insurance.
Exactly.
And so, you really need to be on Medicaid to receive support
Correct.
outside of healthcare. And so we are, really, active and concerned about this issue because, yeah, it's more than 1.85 million New Jerseyans healthcare. It's, their ability to go to work, to go to school, to live the life they want, and many of their family members as well. And we have some tremendous allies in this discussion. And so, Medicaid is really near and dear to the disability community. And we've seen just, a swell across the country of people speaking out for how important it is and what it means for them. And, I'd encourage everyone who this issue matters to, reach out to their representatives about it.
Yeah, and it's very important because I guarantee you either you're on Medicaid or somebody you love is on Medicaid because it's a big program and it's called different things in a lot of states because states have a big role in it. Here we have family care. So sometimes I hear people say, I'm not on Medicaid, I'm on family care. I'm like, it's all Medicaid, or I'm not on Medicaid, I'm in a nursing home. Well, it's Medicaid paying for that too. So just know this is why advocacy is important, no matter how you feel about issues or Medicaid or anything like that, because these issues, people are making decisions about these issues, and you want to have your voice be heard. I always say too that what we're doing at Sills and you as Easterseals as people with disabilities being in the community is still a relatively new idea. It was, people with disabilities were often in institutions before there was a change in philosophy. So that's what Medicaid is there for, to give people options to be in the community, to work, to go to programs, to be out there and not be in an institution, which is also not only not a good place for them, but also I would say it's also very expensive. So we just really need to think about what we're doing. And the other thing I would say, and Matt alluded to this, it's not easy to get on Medicaid either. I think a lot of people think you just wake up with a disability and people just drive with Medicaid. You can't save a lot of money. You can't, you can't do certain things. You can't have certain, there are a lot of restrictions that come with it. And it's not easy to get. There's a recertification every year for a lot of people. So I just don't want people to think you just waltz into, you know, waltz into the office and people are like, here's your Medicaid. This is not what happens. So what would you tell people who are interested in following what's going on with Medicaid, what they should do? What they should follow? Is it social media? Is it the news? What is Matt use?
So I'm on too many emails and too many meetings. What I'd say is the big stuff, will be in the news. Your traditional media, right? The Kaiser Family Foundation, KFF.org is, if you're into more technical stuff, a really great resource. If you're interested in getting involved, you can go to eastersealsnj.org/Medicaid, and we'll automatically connect you with your elected representatives, so you can make a call or email about this. But just following Politico, the New York Times, you name it, should give you a pretty good understanding of what's happening, right? And give you an idea of how to talk about what kind of matters to you, right? Donald, thank you for reminding me that in New Jersey, Medicaid is NJ family, right? And I think for all of us, something that when you go to advocate is important to remember is that we're all faking it till we make it. We all know more
Yes,
than we
we
think
are.
we know just by showing up, as alluded to. And there's a lot of education in this process, right? As we've gone about this, we've heard, people don't know what, for example, a per, decision makers don't know what a per capita cap is, right? Where, it would limit, how much per person could be spent on Medicaid. Or they don't really know that 1 in 5 people use Medicaid. There's just a lot of education to be done, and we are all, foot soldiers for those, messages. And, we've made a lot of progress and there's a lot more to do. But I think the most important thing, is to also say that, the Atlantic Sill at Easterseals, New Jersey, regardless of what happens, there's a lot of fear out there and stuff. There could be changes, some of them could be negative. We will always be here and we will always be doing our best to support our communities, and our communities will be doing the best to support themselves, right? The most important aspect of the disability rights movement is nothing about us without us. It's why I love, working with the Sills, and we are all with it, in this together, and have a lot more work to do.
Yeah, I think that's a great point, Matt. Don't wait to know everything before you get involved, because I do this every day and I still don't know everything. I read everything, I still learn every day. And again, if you're like, well, I'll get involved, but I have to know everything first, like you're never gonna get involved. Just jump and show again. What Matt said is okay. Showing up is like 98% of all this. Just being in the room, it virtually or in person. We had a rally recently about the importance of Medicaid, and not everybody had to speak or say anything. Being there is enough. Being there is enough. Just standing there in support is enough. So you just want to make sure your voice gets heard. I know you do a lot with employment too at Easterseals, so I always want to talk about that, because I want people to understand the barriers that people face when you have a disability for employment, because the unemployment rate for people with disabilities is so much higher than the non-disabled population, and there's a reason for that. And I want you to get a chance to talk about sort of the barriers that still exist and what we can do to reduce them.
Absolutely. So, I mean, Donald, you know a lot better than me, so I'll let you jump in afterwards. But, the feedback I get when I talk to our participants, our job coaches, et cetera, right? First and foremost, education, right? Even if for education, but, of employers, discrimination, even if it's, illegal technically, still exists
Mhm.
informally and formally in some stuff. Transportation, right? You need to be able to get to your job, and we do not, we are a very car-based society, and if you can't drive, you struggle. We do work to break down those barriers. We, our deaf and hard of hearing employment program. We have an ASL, driving coach now. So we try to, meet those barriers and overcome them where we can. But also, just it's a lot for a lot of people. And one of the things that we talk particularly about in your portion of New Jersey, right, is there's a lot of employment that's seasonal.
Yep.
There's a lot of, public transportation can be patchy, in
Yep.
Atlantic County,
Yep.
and, so much more. And, how we not only broaden minds, but, break down those barriers is a really important thing.
Yeah, all those are 100% correct, Matt. And another big barrier, tying it back to Medicaid, is a lot of the programs that people with disabilities are on, whether it's Social Security disability or Social Security income or Medicaid, have earning limits. So it really creates a disincentive for people to work, because if you're going to lose all your Medicaid benefits that Matt was talking about, your community-based program, the people helping you go to work, all that stuff, it creates a disincentive. And yes, there are workarounds to that. And New Jersey, there's New Jersey workability. But I always say, not only do I advocate for those programs, but, and you know this too, Matt, the simpler the better, because this program and that program and fill out this, all that creates barriers. Because I got a lot of people that go, I want to work, but I can't figure this out and I don't want to ruin anything. So you know what? I'm just gonna leave it alone because it's overwhelming. So as advocates, that's something I think we need more voice because it is such a key part of gaining more independence and more freedom is employment, but there's a reason why it is harder for people with disabilities. Access Link exists in New Jersey and they do great work, but as Matt said, if you can't guarantee that you show up to work on time, it's hard to maintain a job. And people are like, well, ask for an accommodation, and that's true, but it's a reasonable accommodation. So, like, maybe I can say, I'll let you show up 5 minutes late, but if you're working in a casino or a restaurant, like, if you come 3 hours late, it throws off the whole thing. So, it's just one of those things that happens, and we're gonna have information about Easterseals, but do people have to be on Medicaid to get Easterseals? What's it like to get services from you guys? What are the rules? If somebody's listening to this and says, I want to go hang out with Matt at Easterseals, what do they do?
Absolutely. So first and foremost, for free, you can get involved in the advocacy work we do by reaching out to advocacy at nj.easterseals.com. We also operate a statewide information referral hotline where even if we don't offer a service, we do our best to, get you information and refer out and collaborate. So regardless of barriers, we do that, and I'll get you that number as well, Donald. So, it really depends upon the population, right? For many of our developmental disability programs, Medicaid is required, or DVRS, Division of Vocational Rehabilitation Services referral. In our deaf and hard of hearing program, that is grant funded, and I don't believe you have to be referred, but don't quote me on that. And for our senior community supported employment program that we operate up in the northeastern part of the state, I believe that is income tested. So to a lot of our points we were talking about, funding is tied to qualification, right?
Right.
Which creates a lot of barriers. We're continuously working to remove a lot of those barriers, but that's what program eligibility generally looks like for us. But as I said, we have a real commitment to trying to just get you whatever we can, as does the SILS.
Right, and I just want to also let everybody know that Matt and Easterseals do not make the rules for their funding. It's funding rules because sometimes people think that this is how Matt and Easterseals would design a program if they were like in charge of everything, and that's not necessarily the case. So I just have to say that disclaimer about about it because I know what it's like to do this work, and you have restrictions based on where you're getting the funding and who you're getting it from, and you have to play by those rules. So it's I always say there's a lot of changes I would make, but that's why I need advocates to come make those cases because I can't be the only one. And I wanted to close on something that I think you and I are both passionate about, which is all really working together as a disability community. I still feel like there are a lot of silos in the disability community, where we can be divided at times between organizations, between different types of disabilities. And I just wanted to give you a chance because you do a lot of advocacy. Why is it so important? Not that there aren't differences, in certain populations, but we have much more in common than we do not. So I just want you to say a word as we're wrapping up why that's important. Not to just see yourself if you're deaf as part of the deaf community, or if you have a physical disability as part of the physical disability community, or if you're on the vision of developmental disabilities, that you're just a part of that community. Why is it important for us to realize that we're in this struggle together?
Absolutely. So, when we work together, we are much stronger, right? It means we have less education to do. We can learn from each other. To your point, I know some advocates in the deaf community who have been working and are succeeding at, getting a right to mental health for the deaf and hard of hearing in this state. right? How do we take those best practices and apply that to other populations? As we've seen a lot of the controversies and concerns in our current moment, right? We've seen people really band together who don't traditionally band together, and how we do a better job of letting people with disabilities lead, and also all work together to really build up this community and this system of care is something I'm really passionate about. One of the things that is just really cool about my job is getting to see all those different pots and how they come together and how they differ. And you only learn if you show up and you talk to each other. And I think to your point, Donald, right? In this time of great uncertainty, I think it's really important to touch on the energy that we've seen from us all working together. To your point about SSI and asset limits, right? We'll be on Capitol Hill next week for our annual Capitol Hill Day. And one of the things we'll be talking about is, raising those SSI asset limits. And that has, a tremendous backing from all across society. Groups you wouldn't think of, bank CEOs who are like, people with disabilities can't save this many people,
Yes.
could be saving, could be contributing to the economy. I just on Medicaid defense alone, I got an email from the ARC today that over 200,000 people have sent messages over there. Anchor, one of my trade organizations in the developmental disability space, over 100,000 people across the country have sent messages through them. So to your earlier point about just getting involved, we're all in this together. You will not, you even if you don't hear what you want, or you will plant the seed, right? This is a long-term process, and it's just getting started. Come on in, the water's warm. Thank you so much
Yes,
for having me.
and the water, and we definitely need you. So don't think like I have nothing to contribute. Thank you so much, Matt, for doing this. And if you want to get involved, you can reach out to the SIL, reach out to the Easterseals, check out their network. There's a lot out there to get involved in, and there's no better time to do it than right now. And you just have to do a little bit. You don't have to do everything. You don't have to save the world. But if we all do a little bit, we can make some real change. So that's how we got things like the Americans with Disability Act passed, which before it was passed was deemed impossible to pass. So things happen, things don't happen until they do, and then everybody goes, "Oh, I can't believe that happened," or "I knew that was going to happen." So thank you so much, Matt, and thank you guys all for listening. And I'll see you next time. Bye.